In this video, I'm going to talk a little bit about the different types of peripheral neuropathy that can present to the clinic. So the most common type of neuropathy that we would see in the clinic is called a length-dependent peripheral neuropathy, and this is because it affects the longest nerves in the body first. So that tends to be symptoms presenting in the feet, such as burning, pain, mild unsteadiness. And this is because those nerves are the furthest away from the spinal cord, and they are considered to be the most metabolically vulnerable nerves. So if you do have a condition causing a neuropathy, these ones would be affected first. It travels slowly towards the knees, and then it can begin to involve the hands, and we call this a glove and stocking neuropathy. It tends to progress extremely slowly. It doesn't tend to involve a significant amount of muscle weakness, and you would rarely end up needing to use a wheelchair if you had a length-dependent peripheral neuropathy. However, it can significantly increase the risk of falling, so it is really important that you would have it evaluated by your doctor if you do experience these types of symptoms. So then when it comes to the evaluation, it's largely going to be blood tests. So you'll be checked for diabetes or pre-diabetes because that is the most common cause of a length-dependent peripheral neuropathy. Vitamin B12 levels may be checked, thyroid function, and then if you had any other underlying condition that might increase the risk for a neuropathy, that will be checked out as well. A group of patients who may end up developing a peripheral neuropathy are those who have been diagnosed with a cancer. So the cancer itself wouldn't really be the cause of the neuropathy, but some of the chemotherapeutic agents can cause a peripheral neuropathy. The good thing is that exercise has been shown in many studies to both alleviate some of the symptoms of a peripheral neuropathy and to also prevent the development of a peripheral neuropathy. So the principles of treatment apply to all of the kinds of length-dependent peripheral neuropathy. The final type is referred to really as an age-related peripheral neuropathy and affects a slightly older population. Now, you would only diagnose this once those blood tests had come back as normal, but it is thought that certain groups of nerves are more vulnerable to the aging process. But again, the principles of treatment in the context of exercise are the exact same, no matter what the underlying cause of the length-dependent peripheral neuropathy is. Now, there are many other types of neuropathy that can present to the clinic. I'm not really going to discuss those in detail here because the presenting symptoms can be quite different. There may be an underlying inflammatory condition, an underlying infection that might have triggered the symptoms. They tend to present much earlier to the doctor. They have a different treatment plan. So I'm not really going to discuss those neuropathies in the context of exercise.